Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board certified plastic surgeons. In that time, I've helped thousands of women in their surgical journey. My passion to educate and help women feel empowered is what led to what we now know as the Big Butts, No Lies podcast. Join in on the fun as I talk to plastic surgery experts, friends, and real life patients about all things plastic surgery. Should be fun. Hey guys, do I have the episode for you? Do I not have one guest? I have two guests, amazing at what they do. Dr. Azizi and Sky are here today with us to talk all things recovery. Dr. Azizi, thank you for joining us again.
Oh, it's a pleasure. There's tons of stuff to talk about, so I'm happy to be on.
Thank you. And Sky, I know this is your first time. You're going to love it. It's going to be fun.
Yay! I'm so excited. Thank you for having me this morning.
You're very welcome. I think, you guys, this recovery topic, we had to stop. Let me tell you, y'all, we had to stop talking earlier because it's just such a juicy subject that once you start talking about it, it goes all over the place because there's just so much information and there's so much to talk about. But what I want us to do is help our listeners know what to expect during the recovery process and not be so afraid of the recovery process from things that they hear, horror stories and types, things like that, but have a more like, this is what you can expect for the first, whatever days. And then this is what you need to look for in your recovery home. So we have a lot of stuff to talk about today. So let's dive right in. Dr. Azizi and Sky, how about before we go into everything else, let's tell our listeners what should they expect in those first 2 weeks of recovery. But before we go into that, Dr. Azizi, what procedure are you doing the most of right now?
I probably do. So BBL is probably the thing I'm doing the most of, either with or without tummy tuck, right? Mm-hmm. So it's either like big lipo procedures with like BBL fat transfer with tummy tuck. Sometimes people are adding the breast. A lot of times people are adding like arms and stuff. So it's usually like big lipo body contouring.
Okay, perfect. So let's pretend our imaginary patient had a combination tummy tuck, lipo 360, BBL. Mm-hmm. What should they expect in those first 2 weeks?
Yeah.
Sky?
Yeah.
Okay, so this is so anytime someone has a combo case, I kind of prepare them up front that their recovery is going to be challenging, just in the fact of like positioning. But for the first day, the day of surgery, I typically tell people you're going to feel very groggy. It's like 50-50. 50% of people feel almost like superwoman. And the fact that like, if you like drink alcohol or whatever and you're like, wow, like I can do this, I can do that. Some people feel like they're okay. And then some people feel like they're like out of it. So I tell everyone on the first day of surgery, like, don't get married to how you feel. Today will be okay, but tomorrow will be a totally different day. So surgery day is kind of tricky. They're either in pain or they feel like, okay, this is okay. Like, I'm all right. Day 2 is the roughest day out of the first 7 days. Day 2, anesthesia is completely gone. Stiffness has kicked in. Nausea has kicked in. Pain has kicked in. So we typically kind of trend up on our pain medicine at that point, and we're just kind of chilling out. Most people can't even really get around really well on day 2 because of stiffness. Day 3 and day 4 are what we call like our wild card days, to where day 3, you're feeling better, but you could really get hit with like severe nausea or a really, really bad headache on day 3 or day 4. Day 5 and 6 are pretty consistent. You're up moving more. You're using the bathroom on your own. We try to start trending down on like pain medicine on day 5 and 6. And day 7, 8, and 9 are kind of like our golden days, to where you've typically learned how to do most of the things by yourself, like put on your faja, how to take your first shower. If you still have drains, how to manage your drains. Pain management, that's pretty much day 7, 8, and 9. And those are like our golden days. And people are like pretty much ahead of the game at that point. They're pretty way better than surgery day and day 2.
Sky, do you want to talk about the really important thing around like day 4 or 5 or 6, like the emotional downturn that happens to so many patients?
That's typically in day 3, day 4, day 5. People feel super depressed and just like, what did I just do? And it's mainly because you have nothing to do but sit around and think. Like, you're very limited.
Staring at the walls.
Yeah, you're just literally staring at the walls. I try to tell people, like, let's read some magazines, like, let's kind of do different things to get yourself outside of your mind or just outside of the four walls of your room. But people are very, very emotional on day 3 to 5, and you really, really need support. And that comes from me when you're in the recovery house, to where I kind of put things into perspective on those days, and they're so grateful. But it's really hard to keep your mental stable during those few days.
Yeah. I find that, like, that's usually sometimes when I get the call or a message from a patient around like day 4 or day 5, when they're just kind of feeling just out of it emotionally. Because otherwise they're like, right after surgery, you're kind of also like excited. You're just kind of doing your thing. You got focus. And like you said, otherwise you're staring at the walls. And it's also the farthest time from when I've talked to the patient and hyped them up. So I usually try to hype patients up on the day of surgery and get them excited, because it's like a big thing we're doing. It's awesome. But it's still a couple days away from when we see each other. And I find that, like, when I see the patient again around day 7 or so, and we talk about like all the good stuff that's happening, and like ignore a lot of this like weirdness and swelling and this stuff. Let's focus on good stuff, like no infection, no hematoma bleeding, no blood clots. Like, that's our first week goals, right? So our first week goals are not cosmetically. Our first week goals are like, we're just trying to get you through
get you out of the woods,
and get you out of the big stuff, like the blood clots, infections, wound healing issues, that kind of stuff.
And those are some of the things that I think we're going to touch on in a little bit. What the eyes of a skilled professional, trained professional during your recovery, how it can help, spot these types of things before they get too far.
Oh, yeah, for certain. The day someone comes to me, there's a checklist that I'm checking off for the first 24 hours that I would like to see like checked off, whether that's your vital signs. How does your skin look? How does your urine look and smell? How are you like getting around? Like, are you able to really like talk to me? Like, of course, talk to me, but you're not like too like super far out, like too much medication on board or something. But I'm looking at everything, the color of your lips. I'm looking at your nail beds. I'm looking at things that patients don't even look at other than your incision. I haven't even got to like your incision or your drains or what is working and what's not working. I'm literally just looking at body language and things that are giving me information, how the well-being of your whole self.
Yeah. So, I look at that body language all the time at day 7. Like, when I walk in the room, before I've even talked to the patient, or if I see them walking down the hall, I'm looking at like, how are their movements? Are they stiff? Are they not? Are they strolling through? Like, I saw yesterday a girl had basically BBL and everything lipoed, and another girl that had a BBL tummy tuck. Both tough surgeries, right? Like, when you lipo everything, or if you have a BBL tummy tuck, both tough recoveries, both 7 days out. The BBL tummy tuck girl is strolling in like nothing happened, and the other girl is like super stiff, right? And that tells you a lot that, like, honestly, when I see people at day 7, they're almost like in 2 different categories. People who are still kind of hard recovering, and people who are just like, oh, this isn't too bad, and I'm doing okay. And that kind of sets the tone for what the rest of their recovery is going to be like, but you can never guess who that's going to be before.
Never.
So and I know we're going to go into this probably in a bit, but when people ask, well, how long is recovery? I'm like, it's better to plan for like the little bit more difficult thing, because you don't know if you're going to be that 10-20% that's just bouncing out of surgery, backflipping, or you're going to be like most people, which is like, it's going to be hard. You know what I mean?
Yeah. Dr. Azizi, what I have noticed on who will do better during recovery, if they are avid gym goers, or if they are very active and healthy in their eating and in their
water drinkers,
if they are on their health, I almost can say like their recovery won't be as bad.
Yeah, they're probably used to recovery, right? Like 3 days a week, they're stressing their body. And I always tell patients that, like, if you're doing a workout 3 days a week, it's like you're putting yourself through surgery 3 days a week as far as your heart's concerned, right? So stuff like blood pressure, oxygenation, all those proteins and everything going around, they're doing that 3 times a week, and their body's kind of getting used to that. Also, like a lot of recovery is mental, and pain is mental, right? So if you're used to being really sore 3 times a week, or putting yourself through something, difficult 3 times a week, then a surgery is going to be easier on you than someone who perhaps hasn't worked out for a year, And then I think the other thing is, how big of a surgery are you getting versus how kind of big is your body, right? So I find that if you, we talked about this in the last podcast, say you take 5-6 liters off of a girl who's a little bit bigger, like 30-35 BMI, they tend to bounce back quicker than someone who's a 20-25 BMI and you're taking out the same amount. It makes sense. You're just, dehydrating and hitting them with more surgery. And also it's like, if you add on a lot of things to surgery, and everybody wants to, and Mavi, I know you've probably seen this from being in the offices, everyone wants to add everything on to that first surgery. Like you're going to,
like this is it.
Everything on the menu, right? You go to a nice steak restaurant, and you want to add on friggin' so many sides, and you're getting a 2-pound steak and everything. And then afterwards, I liken it to you're super full after you've ordered everything on the menu, and it's like having a big surgery and having ordered everything on the menu, and then you're like super sore and you're in pain and you're wondering why. It's like, well, you ordered everything on the menu.
Right.
That is an amazing analogy. I love it because it's absolutely right.
So true.
Absolutely right. It's can we add a little bit of chin? Can we add my arms? Can we add, inner thigh lipo last minute, morning of, just do it while you're in there, Dr. Azizi. You've heard that.
Are easy. I mean, look, and some things are easy to add on, like chin, not a big deal. Okay. Or, a breast lift, even though it takes long in the OR, the body, when you're getting a tummy tuck and a breast lift or a breast lift and a BBL, the breast work is almost nothing as far as your body is concerned. Your body's kind of like what breast lift, right? Or what chin lipo. But if you're adding we have a whole tummy tuck discussion, like I have a consult and we talk about tummy tuck for like 30 minutes. And then right at the end, they're like, I'm thinking about adding a little fat to my butt and stuff. I'm like, dude, that's a whole discussion. And it's not just me adding a little fat to your butt. It's like, you got to position yourself and you got to not sit on the butt and all this. And I think about, well, now I got a lipo on your back. Now we're taking higher volume out. And so that's going to hit you harder from a volume standpoint and like you just feeling blah after surgery. So it takes something that is maybe medium to harder and it makes it into like a next level thing, which is some of the combo surgeries. And, we talked about this, I think, last time, but basically we try to keep the patient only on the table for like 6 hours anecdotally, because after 6 hours, you have a little bit more infection and blood clot risk and that kind of thing. And it's a good limit because there's only so many surgeries you can fit into 6 hours, So it's kind of like limits us to like, even if the patient wants to do everything, we can only get 6 hours of surgery in. So you kind of got to pick what's going to make you most important.
Mm-hmm.
Exactly. Mm-hmm. And then, you do your one big surgery and then your next surgery 6 months later is like a medium surgery. And you're like a pro, people usually that do that big BBL tummy tuck initially or the big body contouring one initially, when they're doing that, 3 months or 6 months later surgery for like their breast or whatever, or their arm lipo, they bounce back from that super easy because they kind of have this big expectation and they've kind of gone through it also, That's absolutely right. So let's talk about recovery homes. Now we know, okay, what they can expect, right? During these first, 7 to 9 days. Now we know. Let's talk about what to look for in a recovery home. What are some red flags for them to look out for?
Oh, yes, for sure. One of the top things that I would say when looking for a recovery home is credentials. Just like when you're looking for your surgeon or your massage therapist or whoever's involved with your care, you want to look for credentials, whether it's the RN, LPN, CNA, medical assistant. You want to kind of see who's all involved in the house and the care. Also, a big thing that I would look for, of course, is their social media presence. And if you can call them, I tell people, call your recovery houses, talk to someone, if not the person taking care of you. There shouldn't be any reasons why you can't ask a question and have your question answered, whether it's how far are you from the surgery center, what's all included. And then from that phone conversation, kind of get a vibe of that person. How do you feel when you talk to them? Do you feel like they have an attitude? Do you feel like they were patient with you? Do you feel like they're knowledgeable? Do you feel like they're dependable, trustworthy? Because you want to get all this stuff squared away, because once you have surgery, you are out of commission. So you don't want to, be left in someone's hands that you don't feel 100% comfortable with. So I would definitely look for those top things when looking for a recovery house, hands down.
Also, just to add on, anyone can call themselves a recovery house too, right? So like how anyone can take a weekend course and call themselves a cosmetic surgeon, but they're not actually, they could be a ER doctor that did a weekend course and they can be called a cosmetic surgeon. They're not an actual plastic surgeon. Just like anyone who could do a quick course and become a recovery house, but they're not like, you don't have a nurse or an LPN or someone who's medical or someone who knows what bad stuff to look out for when you're there for that first week, so you kind of, and I also think about it that would I send my family member there, right? So there's recovery houses that, yes, they'll be able to take care of you and you can get through it, but maybe it's a crummy experience. And when I think about would I want my sister or my mom to go there, I'm like, I don't want that necessarily. So I think that goes with that vibe. And when you call that person, the customer service that you're getting before they even have your money, if they're like, it's good customer service and they're nice and it's like a nurse or an LPN or someone medical, I think that goes a long way.
Absolutely. So in this section, how long for each procedure should they be planning for?
Yeah, so I typically like to talk to my guests, or they'll fill like a questionnaire to let me know what procedures they're having done. So at Shapes Recovery House, the minimum stay is 3 nights. Realistically, I don't think that anyone will be ready to go in 1 or 2 days. So 3 days is the minimum. And then depending on what procedure you have, if you're just having one procedure, like say a tummy tuck or just tummy tuck alone or BBL alone, about 3 to 5 days would be a nice stay to where you are comfortable. You've learned a lot of how to take care of yourself or teach whoever's going to be taking care of you at home from that time you leave. But if you add on combo cases like tummy tuck, BBL, then we need to start thinking about additional days, whether it's 6 days, 7 days. Some people have drains. They don't want to go home with drains. They don't want to deal with drains when they get out. So they may need to consider 7 nights. But it depends, but on average, and we have like an extension rate of like 85, 90% from like 3 nights. So on average, 3 to 5 days just for a sole tummy tuck or just for a BBL. But whenever you get into combo cases, we need to have a discussion about longer.
Yeah, I think that's solid. For me, I think the drains are a big part of it and like how comfortable patients are. So for BBL, if someone's coming in from out of town, I usually want them in for a week, so that I can see them at the 7-day visit. And then I know that we can get a drain out and we can send them home. I do this because most problems that are going to pop up, like infection or seroma or blood clot or stuff like that, anything weird, wound issues, are going to usually show up in the first week and we can kind of handle it. And then I can send them home with instructions and we'll do virtual touch bases and that's cool. If it's a tummy tuck, I personally use 2 drains in a tummy tuck. Usually one comes out at week 1, the other comes out at week 2. But if you're getting a big combo surgery, big lipos, big all this stuff, you put out more fluid. If you put in, those drains are a little harder to get out. I don't really want to send people home to like Florida from Chicago or back home to, not in Chicago where I'm at with a drain necessarily, right? So I want those people to stay for 2 weeks, for example, so we can get them all buttoned up and stuff. And like Sky said, like maybe you don't need to necessarily stay at the recovery house for those 2 weeks, but the first 3 days, 5 days, 1 week is great. And especially if you're doing combo surgeries, the people at the recovery house are usually going to have a little bit more tricks as far as like positioning, and like you will learn those tricks in those first handful of days, so that maybe when you go to your Airbnb afterwards or your hotel for the next, that second week, you now know how to take care of yourself and you're doing a little bit more for yourself. I'm a little bit more conservative about my recommendations as far as how long people should stay in town and stay in a recovery house, because like what we alluded to before, you don't know if you're going to be that 10-20% that is backflipping out of surgery with no problem. But most likely, you're going to be that, 2/3 of patients that's just having a hard recovery, and it's a 1 to 2 week recovery. And, when I see a lot of plastic surgeons online on Instagram talk about a certain surgery, and they have this little blurb of like how much it costs and what is the recovery, and the recovery is like, oh, it's 1 week. And I'm like, well, after 1 week, you may not feel like death,
you're ready.
but you're not ready to go back to your job after a week. So no. I don't like sugarcoating the
That's a little misleading. I feel
it's totally misleading. I think, and surgeons are more incentivized to write a lower recovery because they want you to like book surgery and be like, oh, whatever, I'm this BBL. It's like 2 weeks and I'm good. And I'm like, I don't know. I do a lot of BBLs and I do a lot of lipo. I do a lot of tummy tuck, a lot of breast, and it takes longer than what sometimes people think. And I tell people sometimes too, like, if you have a desk job, and let's say you get a tummy tuck or something where the butt doesn't matter. You're not sitting on the butt. It's not an issue. That first week, you got to take it totally off. The second week, maybe you can work from home. Maybe you'd be able to drag yourself into the office, but you're not going to feel like it. And it's going to be kind of like when you have like a really bad cold and you drag yourself to the office and you're like, yes, I can go through the movements, but I just don't want to be here and I don't feel like being here. So I'm like, just give yourself that 2 weeks or the 3 weeks off, and you're going to be feeling much happier that you gave yourself that time off from work. And if you're feeling like, if you're like a rock star and you can go back sooner, then awesome. But don't bank on that right away, though.
We should plan for 2 to 3 weeks. And if you feel better before then, good and awesome. And you rock and go for it. But if you don't, at least you've already mentally prepared yourself for being out for 2 weeks.
Right.
That's what I think.
I think 2 to 3 weeks is perfect for most surgeries, whether it's a tummy tuck or a BBL or a big combo surgery, because usually everyone can like work out at 4 weeks. Like they have enough energy and everything to work out at 4 weeks. So at 2 to 3 weeks, you can like go back to the office or something.
Yeah. And I will say some people underestimate, even if you feel good and you're like, oh, I can do it, you go do it. And then that next day we've taken 3 steps back because, you just underestimated, or we were feeling good, but each day is still very different. So, I agree. You definitely want to give yourself more time than not, because sometimes we feel like we can do it and then we've done it. And then it's like, oh, shoot, I shouldn't have did it.
Totally. I think it's really important in the first few weeks to have very focused recovery on just sitting and chilling and like catching up on Netflix, that kind of thing. Because if you push it, like Sky said, like some of those patients that I have that don't feel a lot of pain, and I'm seeing it in week 1 and they're doing great, I worry about those patients that are not having that much pain, because the pain is actually protective and it keeps you from moving a lot. So when I see a patient at 1 week and they had a big surgery and they're feeling like $1 million, I give them a pep talk like, listen, you better chill. I know you want to move around. You want to be a superstar. You want to clean the house. You want to do all this to just kind of prove that you're bouncing back. But your body is going to swell up. You're going to put a ton out of your drains. The next day or two, your body is going to hit you back with more extra pain that you were not expecting, even from simple things like making a whole bunch of dinner for yourself, or cleaning the house, or like vacuuming, or like these kind of like household chores, or just doing the dishes. I hear this all the time. Week 2, week 3, people are like feeling really good. The pain's gone. They do the dishes, they clean the house. And the next day they call me. They're like, I feel like I was hit with a bus. And I'm like, it's just your body's just not ready for it. So you really just got to give yourself that first 2-3 weeks. And then later, like you get to 3-4 weeks out, it's going to be much better. Your body's ready for it at that point.
Absolutely. And do not rush yourself. You'll regret it.
Right.
You will regret it.
Well,
It'll take longer to recover. If you rush it, you get hit back. It takes longer. So just spend the time and you'll recover quicker if you actually have focused recovery.
Absolutely. So, Dr. Azizi, I know you got a bunch of questions through your Instagram about recovery, and these are all really great questions that patients ask. And I feel like there's the confusion about it. One of those things is that we have here difference between a drainless tummy tuck and one with drains. I'm super team drains. So just so y'all know.
Yeah. All right. So true. And I think this is hard for patients because, you'll go see one surgeon and maybe they'll be like, oh yeah, I use drains. And the other one's like, I use drainless. You don't need drains, and they're like at odds. And you're like, how am I supposed to figure that out as a patient?
Exactly.
So, a traditional tummy tuck, and what I would say the majority of plastic surgeons, maybe 80 or 90% are doing is like 2 drains, 1 or 2 drains, and those drains come out within 1 to 2 weeks. That's kind of like traditional, right? And then there's a drainless tummy tuck where no drains are used, but it's still like 1 to 2 weeks, or 2 weeks recovery. Now, how are these surgeries different? First of all, so when you do a drainless tummy tuck, or you do a normal tummy tuck, when you do a tummy tuck, you're creating space inside the body underneath all those skin flaps, right? And that space can fill with water like a water balloon. And the drains are there to pull that water out so that space on the inside basically shuts down, it Velcros down, the space goes away, and you can't fill it up like a water balloon. And that water balloon is what we call a seroma, right? So it's like a fluid collection, right? So the drains are there to basically pull this out, let everything tack down. Awesome. In medicine, there's no free rides in medicine, meaning that like me as a surgeon can just decide to do a drainless tummy tuck tomorrow and the body's going to figure it out. I actually have to do things to be able to do that. So a drainless tummy tuck, what it does is that space on the inside of the body, you do certain kinds of suturing, tacking sutures underneath those skin flaps that are basically like spot welding the little areas down so that you don't have a big open space, but you have like kind of less open space, and the skin flaps are tacked down so it'll put out less fluid. But what I said before about not having any free rides in medicine, so I have friends that do really great looking drainless tummy tucks, but here's what happens. You got to leave like the hole in the back of the butt like open so it drains out somewhere, or you have 2 holes down low by the pubic area that the stuff will drain out. So you don't have a drain, but it's still draining out from somewhere, right? But the fluid doesn't magically go away. Or you're dealing with more seromas, meaning those holes down low, they drain out a bunch in the first couple of days. You're doing your compression, but then you kind of fill up the fluid again. Why? Because we took 4, 5, 6 liters off you, and the body's trying to fill 4, 5, 6 liters of fluid back into those areas that we took off. So it's kind of like you got to pick your poison. So for me, I'm all about the drains because The drains are sitting there, they're active, they're less messy, so you don't have the fluid going all over the place. And they're pulling the fluid out. And then we know that like when the drain comes down to a certain level, and that level usually is 30 milliliters in 24 hours, if it's less than that for like 1 day or 2 days, then we know we can pull it out, right? So that's the thing with drainless versus drain tummy tuck. So if your surgeon is comfortable doing a drainless tummy tuck, that's cool. And there's a lot of guys that do it and they do it really well. And it's, really nice results. But you're probably going to have a hole somewhere. You're probably still draining somewhere. It's probably a little bit still messy. Obviously, I'm biased towards using drains, but drains work. They work good. It's just kind of like I think you have to wrap your head around the fact that you got to have a drain, just like how you're going to have a scar with a tummy tuck. There's no like scarless tummy tuck. And so it's like, there's no fluidless tummy tuck, which means that like a drainless tummy tuck, you're still going to probably have like a seroma maybe, or drains or fluid coming out of you somewhere.
On an episode I had with Annalisa a few months ago, we were talking about this, and she was a coordinator for a physician who did drainless tummy tucks. And we were kind of going back and forth. I'm like, well, why not have the drain? And she said, it's a higher risk for infection. Girl, if you don't talk to me.
Yeah, no, I know, right? So, okay, look, if you have an implant, let's say we're doing a breast surgery and you have a foreign body like an implant there. Sometimes we don't want to use a drain next to an implant because the bacteria can kind of creep on up that drain hole and kind of go next to the implant if you have a foreign body. We do not worry about that when it comes to like a tummy tuck in the body itself, because now here's the thing. Sometimes in medicine, we actually put a drain to drain out bacteria, or to drain out an abscess or an infection. So it's like, well, the treatment for some infections is a drain, right? So it's pulling stuff out, but it's pros and cons. You don't have a drain, you're a much higher risk for a seroma rather than like an infection risk. And here's the thing. If we were putting drains in people and we were getting infections left and right, then we would all be trying to figure out ways to do drainless tummy tucks. But the infection rate for a tummy tuck is still only like 1%. It's really rare. And so it's kind of fine then, you're not doing that. Oh, another thing, I've covered for a plastic surgeon in Chicago that does drainless tummy tucks. And anytime that person is out of town, I'm like, those patients show up in my office to get seromas drained all the time. So I was like, dude, I'm not going to be doing this myself.
I agree. In a previous episode, I said, don't y'all think that just because they're drainless means that they're not having a higher seroma.
Yeah.
I was just going to say, I mean, it's a drawback to almost anything. It's like Dr. Azizi said, it's kind of like, picking your poison. There's something that's going to come with any procedure you have to deal with. So, whether it's a infection or whether it's a seroma, we would kind of lean on less, seromas than a low risk of infection.
Mm-hmm. If they're not doing a lot of lipo, remember, like if you do a lot of lipo, you're going to put out more fluid. You should probably get a drain. Some surgeons, maybe they're doing a drainless tummy tuck. Why? Because they're two-staging it. They're doing all your lipo in one stage, and then you coming back just for a skin excision. Little different story then, but if you're getting 5-6 liters of lipo, like most people want, you're going to put out a lot of fluid. That's why.
That's right. On that note, what do you think about, so let's say our imaginary patient had a tummy tuck and 360 liposuction, and she's heard conflicting recommendations. Her surgeon is telling her no massages for at least 3 weeks. But online, she's hearing about getting massages for drainage of the fluid from her back. So what should these patients do? I mean, it's kind of, what do I do? They ask me because they don't know. I'm like, follow your doctor's orders.
Yeah, I know. So first of all, I'm also going to say follow your doctor's orders. So I'll get messages from patients who have had a surgery by somebody else. And I'm like, I don't know what they did for you. I'm not responsible for you, so I can't really make a recommendation based on that. So you got to follow your own person's order. But we'll talk about like, what is the deal with massages, with tummy tuck or not tummy tuck, and like, why is there so much discussion around it, right? So a lot of people were not doing massages here in the US like 5 years ago or 10 years ago for sure, and we started to see more lymphatic massages coming out of other countries, specifically out of like South America, right? And this is like, as our techniques got more advanced in surgery and you're getting more fancier surgery, you kind of have to have fancier recovery so that you can get those fancier results. So why did I first start doing lymphatic massages or recommending them for my lipo patients alone, when I was doing a BBL or a lipo 360, is that people that I was getting massages for, or people that would go get massages, even when I was like, oh, you don't need it. And they're like, well, do you mind if I do it? And I was like, yeah, cool, go for it. Because obviously there's time and cost involved. So I don't want to recommend something that I don't think is actually making a difference when there's time and cost involved to the patient. But the people who got their massages would come back and they'd be physically feeling better because it helps to desensitize the nerves. They'd be looking better because all that kind of fluid and swelling that's sitting in their tissues is being pushed out to their lymph nodes, and then they're recirculating it and they're peeing it out. That's where the fluid goes, actually. The lymphatic massage works mechanically by pushing water towards your lymph nodes. Your lymph nodes recirculate it back to your bloodstream. Bloodstream goes to the kidneys, and then you pee it out. That's how the fluid goes out. Okay. So these people that were coming back from massages were looking better. And then as I started to do more high definition lipo, what I noticed was if someone did not get their massages, all that beautiful results that I got on the table would not be popping up later. Okay. Like they would just kind of go away and it would look more like average lipo. But if someone was all up on their massages, it's kind of like, hey, we want to have these amazing high def lipo results. It's all hands on deck and we all got to do everything. Meaning the surgeon's got to do a awesome surgery and the patient's got to do an awesome recovery. But it's not like we can just pay for it and then hope it happens, right? So we're a team. We got to do it together, right? So we know that, okay, lymphatic massage is good for lipo and BBL. And that's not too controversial these days, especially amongst younger surgeons or more progressive surgeons. And I find that it's only either the less progressive or the older surgeons. Doesn't mean just because you're older, you're less progressive, but you can be both. But I mean, less progressive or older surgeons are not recommending massages as much or kind of against it, right? So then it comes to tummy tuck, right? So tummy tuck is a little bit more controversial because we have, like I said, you have that open space. You're using some drains. And most importantly, you have that incision. So you got this incision where you did like hundreds of stitches on. And, that incision is pulled tight. And we're often, as plastic surgeons, very wary and very paranoid of anyone pushing on that incision. So we usually don't want people pushing on it. So me personally, when I do a tummy tuck, I'm not worried about people getting massages on their back. Awesome. Go for it. Massage on your back. I'm okay with that. But remember, logistically, you book a massage with a lymphatic massage person, you go, you kind of got to lay on your belly. Maybe you lay on your side. Maybe you're doing your back. So logistically, it's hard for someone to get that back massage just when they had a tummy tuck or BBL, maybe just for the back, right? That's why I usually recommend starting your lymphatic massages about 3 weeks or 4 weeks after a tummy tuck, right? Now, listen to me in this next part here, because there's a specific reason why I recommend this. And even myself, I would want to start them sooner. Here's why. We got the drains in, right? When you get a massage, and they push all that fluid around, your drain output increases. And like your drains may go from 30 up to like 70 or 80 cc's in a day when you get a massage. And when we're spending that first week or two, we're trying to get those drains out. If you're getting massages, which is fine, it's probably not a bad thing to get massages, the drain output's going high. And then remember when I said about we're trying to get it to 30 cc's or less in 24 hours? We don't know where we stand with that then. So we don't know when to pull those drains out. Are you truly putting out that much fluid like your body is, or is it kind of from the massages and your body's actually less? So it confuses the picture, harder to get the drains out. So when I get the drain out like week 2, we give them a week, all the tissues on the inside Velcro down, like we said, all that space is kind of closing down. And then week 3, I'm okay with them going and getting like lymphatic massages. Now, having said that, in Colombia, and what I learned when I was training in Colombia with Hoyos, Alfredo Hoyos, who's like one of the best, if not the best, body contouring high def person in the world, they do a tummy tuck and they start massages at 1 week after surgery. But there's a lot of things that are done a little bit differently. So when they do their tummy tuck, there's certain tissue planes that they dissect in a different way than we do here sometimes in the US. And then number 2, they put patients in a hyperbaric chamber. So he's doing patients in a hyperbaric chamber 3 times a week after a tummy tuck. And we do not, like, no one's getting hyperbarics here in Chicago or the US. Really, like, not a lot of people are. No one really talks about it. It's one of the things I actually want to do.
Usually, unless something's going wrong.
Exactly. And so there's logistics to that too. Like, here's why. Because the only hyperbaric chambers are at the universities and the hospitals. And like for a private person to go there and do it, insurance usually isn't going to cover it. They usually don't have like a cosmetic fee schedule where a private person can go to the hospital and get it done. And maybe it's going to cost like $400 for a session each. So that's pretty pricey. So number 1, I wanted to get a hyperbaric chamber for my own office that we're actually building out so that I can start doing this. But if Hoyos and those guys are putting people in a hyperbaric chamber because they have easier access to that in Colombia and cheaper, and they're healing, they're getting all that oxygen. So hyperbaric chamber basically gives you oxygen at a very high level, and it helps to decrease, like, supposedly decreases swelling. You're definitely going to feel better with a lot more oxygen. More oxygen to your tissues and that incision is going to make it heal quicker. So then potentially they can start doing the massages at 1 week because they have kind of increased or kind of quicker recovery. Why? Because they're doing this adjunct like a hyperbaric chamber or perhaps a little bit different surgery. So that's why it gets controversial. You know, if someone really wants to get massages on their belly the first couple of days, they want to self-massage it, or the first week or two, it's probably not the end of the world. And the incision will probably be okay but we still don't know where we stand with that drain output. So that's why it's more confusing. And that's why now I recommend massages at about 3 weeks or 4 weeks after a tummy tuck, about a week or so after the drains are out. But, a year from now, I may be in a different position where, like, if I'm doing hyperbarics for all my patients and all of a sudden the drain output is way less, maybe we can get massages started sooner. And that's where all the controversies basically sits with all this kind of stuff. Those are relevant issues.
This is amazing, Dr. Azizi, because in the last episode, this is what I was asking. These are the questions that I'm like, I'm wondering. I'm trying to figure this out too. And, I think our listeners will be so thankful to just have some clarity, hear from the surgeon why we don't want, and I touched on it. Yeah, I wouldn't want my fresh incision, this flap I just put down, to be pushed around, waddled around. I wouldn't want that. So this is very good. I think we've touched on how post-op care has, evolved, and it's evolving very quickly. And I feel like the younger surgeons like yourself are catching on, and we're trying to bring, the best practices for our patients and keeping them safe. And I mean, what more can we ask for as patients?
And then remember, it is always evolving. It's important to go to a surgeon. Obviously, I'm biased. I want to do the best work. I try to stay up on the latest techniques and technologies. So yeah, you want to go to a surgeon that does a lot of it, gets good results. And then you've talked about this on many other episodes. If they're, 60 years old and they got a very active Instagram, they're putting out a lot of great results, and they don't do massages, for example, remember, you have to kind of trust them, right? So like, you appreciate their style, you like their aesthetic, you went to them, you got a good vibe. You don't want to mess with what their special cocktail is that works for them, know? So just because it works for me and I'm trying to do it because I'm trying to follow this other like Colombian way of doing things, but this other surgeon has gone down this other route and it works really good for him and he's getting the results. Ultimately, like, if they're getting the results, they're active, they're putting a lot of photos out, they're, you jive with their work and their style and their personality. You don't want to introduce something odd into their mix. But usually if they're very confident in their skills and their ability to deliver a result, they're still willing to listen to you, ask them the question of like, can I get a massage? If not, like, why do you not like it? So those are the questions that you bring up during the consult.
Beautiful. Sky, this question is directed to you.
Okay.
During the recovery time for a liposuction only, and they're getting the massages and these incisions close, are you opening them for them? Are you leaving them up to the doctor, like sending them back to their doctor and having the doctor decide? Or, I think this is one of those things that's kind of everybody's doing their own thing.
Right. This is a great, great question. I'm glad you brought this up. So let's talk about it. So I am not a fan of reopening incisions in a recovery house, or I let that be decided by the surgeon. So when you see on Instagram, like, people putting or sticking things in the incisions, I've had many, many girls tell me about Q-tip, the wood part being like stuck in their incision, jammed in to like reopen incisions. I do not suggest that. I think that's very like high risk for infection. You could trauma the incision that's trying to heal and close. That's the natural way for a body to heal or scab over. So we do not. And plus, if you're doing anything with any type of tools, they need to be sterilized. They need to be clean and sterile. You also want to get the surgeon involved. Like with seromas, when you drain a seroma, and that's in the scope of our practice to do, but when you're draining a seroma, like, you need to know how much is coming out, what the color is, maybe if there's an odor. All of this stuff needs to be talked about with the surgeons. The surgeon needs to be very involved with that. So I am not a fan of it. We do not do it here at Shapes Recovery House as far as reopening incisions. If a surgeon leaves their incisions open, we take full advantage of it in the first few days before the incision closes. But once the incision is closed, I then direct them to their surgeon and kind of get orders from them of like what they want to do next. So that's my opinion on it.
Perfect. And that's, I mean, I honestly, when patients ask me, I tell them, leave them closed. So I'm interested in hearing what you have to say, Dr. Azizi.
Yeah, I think you got to leave it to the surgeon too. I agree. I mean, even me sticking a wooden Q-tip or whatever in there, I'm feeling paranoid about that. And I'm a surgeon. I'm like, am I going to cause trouble here? Like anything I'm sticking in there, I'm prepping it with alcohol. I'm usually using like sterile instruments right out of the autoclave, or instruments that are just being opened right away to reopen something or drain something or this and that. I think the other point is that the management of a seroma. So like, okay, maybe a massage therapist or an RN drains a seroma. They get 10 cc's out. The thing closes up. Fine. Okay, cool. But I've had situations where it's a bigger seroma. What's a big seroma? 30, 40, 50 cc's. These are bigger seromas, right? So these things need to be managed. They're not just going to go away with one drainage. And what happens, what I've seen, this is difficult. It's like patients week 3, week 4, I think they're doing good. They've disappeared. They're getting massages. They call me at 6 weeks and they're like, so my massage person or this person drained me a couple times and this thing's not going away. And it's like week 6. And I'm like, okay, so how much did they drain? And they're like, well, it was like 50 cc's and then like 80 cc's. And I'm like, dude, we got ourselves a fluid issue. I don't know how to handle that because I don't know how much this person's draining it. I don't know where the pocket is, right? And if you get like 4, 5, 6 weeks out and you have a seroma that's been hanging around for a while, that seroma is going to want to develop a cavity and a shell and like almost to the point where you're going to have to maybe go back to surgery to remove that seroma. You can't just drain it away. And so we have a crucial period in the first month to be all hands on deck with seromas and make them go away and resolve them. And if someone else is draining it and it's not going away, I don't know where we stand. The surgeon's not involved to be able to take care of that. And then there's also the cleanliness issue. So a seroma is nice and sterile on the inside, but if someone is not prepping that skin or using sterile instruments to get in there, you can introduce bacteria right into that. And now it becomes like a you wouldn't leave a soup out for a week and then eat it. You know what I mean? Bacteria is going to grow all over that soup. And that's like the soup had no bacteria initially. That soup is like that seroma. Like it's just going to introduce bacteria in there and then it's going to grow. So we don't know where we stand as a surgeon. Your surgeon should be managing a large seroma, which is really anything more than like 10 cc's or for sure 20 cc's or so that you can get over it in the first month, basically. That's what our goal is.
And honestly, you guys, let's go ahead and put it out there. If your massage therapist is not really supposed to be poking your body with any sharp instrument, I don't think massage therapists are even supposed to do injections. Those things might vary state to state on what they can do. But personally, I would not let a massage therapist, even though they have experience, I know they have experience, they know what they're doing. But personally, I would like my surgeon
yeah.
to be 100% the one doing anything.
Exactly. That's like what the surgeon's managing it. And like, look, it's tough because some girls get their surgeries out of the country and they can't get a hold of their surgeons and they're back. And the only person they have is the massage therapist. So that's how I'm sure all this stuff came to be, where massage therapists are draining them because like these poor girls have these huge seromas and they can't get a hold of their surgeon. And like, what are they going to do? Right. It's a tough
predicament to be in.
Yeah.
For
but
sure.
also you should be able to get a hold of your surgeon. Like that's what post-ops are all about. Like you should be able to like, if our patient's got a seroma or an issue, like I'm seeing them every week or like, twice a week if we need to or whatever, because like this is what it's all about. I don't just do the surgery and see them 6 months later and take photos. Like that's why we see them so much the first month.
Dr. Azizi, how in the first month, if a seroma were to develop, when would they be seeing it? In the first 2 weeks? Is it earlier in the recovery, later in the recovery?
Usually it's earlier. So let's say you have no drains. Okay. So either a seroma is going to show up either if you have no drains or after a drain is removed in general, right? So if you get lipo, you get a big lipo case, they leave the holes open and you get your massages and then like the fluid's kind of showing up. It'll usually show up like a week or two after surgery, and because the holes close up in about 2 days, right? So all those holes, when we take a drain out or after surgery, holes close up in about 1 to 2 days. So a seroma is going to form usually in the first week or two because that's when, remember we talked about that space inside your body has not collapsed down and hasn't velcroed down. You still have that space. Or if you take a drain out, let's say you take a drain out prematurely. And sometimes we take drains out prematurely because we think everything's okay, or we don't know if, patient maybe mixed up their numbers or it's appropriate, but like patient got really active afterwards. They put out a lot more fluid. So you take a drain out and then they just get this like fluid wave or whatever. It'll usually show up in the first week after you take a drain out. So if you take a drain out or you've had surgery and you don't have a seroma after 2 weeks, you're generally not going to get it at that point. 1 to 2 weeks, like it's just not going to show up a month later. Something's weird. If it's a month later, that may have been a slow seroma that was just kind of sitting there and you never really noticed it, or like no one really brought it up, or you didn't see your surgeon, that kind of thing. So generally a week or two after surgery or a week or two after the drain is out. And after that, you shouldn't really be getting one.
Perfect. And I think our listeners to know that will calm some of their nerves, because I feel like they're nervous about getting a Seroma for months after.
Yeah, you get that all the time. Mm-hmm. Yeah, like you're a month or two later, 2 months out, 3 months out. Patients often worry. They're like, is it a fluid collection? Why? Because they've gone online, they Googled it, and just throws seroma all there. It's like, no, if you got through the first month and your seroma is gone, your drain's gone, and everything's like resolved, you're not going to get a random seroma 3 months later. That's just swelling. 2 months later, it's just swelling,
Perfect. Sky, did you have something you wanted to add?
Oh, no. I typically hear a lot of people, that's one of the top things that people are nervous about is seroma formation. So yeah, this is a great section.
Perfect. Okay, you guys. So let's talk about pain management. So I think a lot of our listeners, when they're planning their recovery, they think they're going to be in a really, in a lot of pain. And I think that makes them, the anxiety levels go up, nerves go up. And let's talk about pain management and what they should do and expect.
Pain management is a bit tricky because it's subjective. So, someone's pain could be someone else's like, no, this is a breeze. So whenever I talk about pain, I talk about what the surgeon has prescribed them, which is typically Percocet. We see that pretty often here in Chicago. I have some surgeons who don't order pain medicine at all. So then we have to talk about other things that we can do to kind of make pain as tolerable as possible. My blanket statement to everyone is you are going to have some sort of pain. To have zero pain is to kind of like have no surgery at all. So the goal is to get the pain as low as possible. So of course you have Percocet. In a recovery house, there's really nothing higher that we have higher than Percocet. We don't have any stash of magical pills that'll take all the pain away. But of course, I'm a big fan of Arnica tea and Arnica pills. I'm very holistic. So we'll do that in between pain medicine, whether it's ice, whether it's CBD or THC. I try to kind of get approval of surgeons for like THC, CBD stuff. And then I ask, of course, if we've ever had that before, because we don't want to give THC to someone who hasn't had it before.
That's a good point. Yeah, that's worth saying for sure.
Yeah, exactly. My very first question, like, have you ever had THC before? So, but the goal is just to get it as low as possible and just to kind of set realistic expectations about pain, knowing that you will have some sort of pain at some point during your recovery. And we just kind of have to find ways to get it as low as possible.
Yeah. So from my perspective, it's kind of like after surgery, best case scenario, the first couple of days or the first day or so after surgery, probably we can get it down to like a 5 or 6 out of 10. And then maybe at 1 week, you might be like at a 3 out of 10. Sky, would you say that those are approximately decent numbers?
Yeah, those are about average. You have some people who, have a lower pain tolerance and some people who tolerate pain very, very well. But on average, that's right on the marker.
Yeah. So from my perspective, first, you only got a couple choices when it comes to narcotics. So the strong narcotics that we can prescribe are you got either Percocet or you got Norco. Stuff like Vicodin, they don't even allow us to do that anymore. Like it's Vicodin going off the market a while ago. Stuff like writing for like a Dilaudid or morphine like pill, you can't do that either. So like you can't really prescribe just the pure oxycodone or hydrocodone. So what something like Percocet is oxycodone with Tylenol. And what Norco is hydrocodone with Tylenol. So I like to write for Percocet. So you got two choices. You're getting a big surgery. I got to write you for something strong. Our choices are Percocet or Norco. The reason I write for Percocet is that I find that way less people have issues with nausea with Percocet, and they have way less like itching and issues with Percocet than they do Norco. So that's just a personal choice for me. A lot of plastic surgeons write for Norco. Now, if you're getting a tummy tuck, I usually like to inject Exparel into the muscle repair. So the most tough part about a tummy tuck is when they do a muscle repair. It doesn't mean you shouldn't get it, but that's just kind of what most of your pain is contributing from. So Exparel is a long-acting numbing medicine. It lasts for 3 days. So we inject it along the muscles and usually along the incision, and helps to take the edge off those first few days because obviously your first few days are going to be the toughest. So as your body's healing, we're trying to kind of bridge that by giving you Percocet for the pain, give you the Exparel, and then have you take it easy, and then you should be okay. I find that when it comes to something like Lipo360 or BBL, that people take the Percocet about 3-4 days, and then around day 3, day 4 is when they start switching over to Tylenol, and then taking the Percocet at night when they're trying to sleep or for a massage, right?
Yep. That's what I typically tell them as well.
Awesome. Awesome. Yeah. For a tummy tuck, I think it's a little longer. Maybe half the patients or a third of the patients might still be taking some Percocet at 1 week. Usually we write for like 30 tabs. Those kind of run out in the first few days or 1 week. the patient rationing thing is actually not a bad thing, because if I wrote for 40, so here's where the doctor responsibility comes in. And it's really important because narcotic abuse and narcotic stuff is a really huge deal in America now. So doctor responsibility is really important. So I write for 30 Percocet tabs because I know that that is a good amount to get the vast majority of people through it all, right? So if I write for 40, most people, what I've found, are going to eat 40. And if you give them 30, they're going to take 30. If you give them 20, they're going to ration it out. And it's better to ration it out because you often do not need sometimes as much as you think you do, right? You're not going to take your pain down to a 0 out of 10. You got to kind of get it to 3 to 5. And then we're just trying to get you through the first week. So when I see patients at 1 week and they've kind of gotten through all their Percocet, I will then step it down and write for Tylenol number 3. Tylenol 3 is Tylenol with codeine, and it's not as strong as Percocet and Norco, but it's a good kind of middle ground if they're not ready yet for regular Tylenol and they're still having pain. And at that point, we get 2 weeks out. Like if you've gotten a Tylenol 3 and we're kind of 2 weeks out, I'm cutting it off and you're just taking Tylenol at that point, because as doctors, we have to be responsible and we can't just write for narcotics all the time just because patients are feeling pain, or, if they're a week or 2 out, it's time to kind of pull it away and allow that body to just get used to less of it, because your body's going to get used to having Percocet. You will have like phantom pain that's not like real, but it's more kind of like withdrawal Percocet type stuff, right? So we got to kind of give them a little bit of tough love, a little pep talk, and kind of get them through that. I personally don't like ibuprofen or Toradol or like a Aleve in the first at least three weeks or 4 weeks after surgery, because it's so these NSAIDs, stuff like Advil, ibuprofen, Motrin, Aleve, these things can cause a little bit more bruising and bleeding. And like, okay, bruising we don't care about because it'll go away, but bleeding, we don't want that. So I'm more conservative. I just want you taking either the Percocet or Tylenol. And maybe if you get a month out, you could take some ibuprofen, but I'm not a big fan of that. Now, some people will write, there's some other protocols out there. So sometimes people will write for something called gabapentin, which is something that helps to dull down the nerves. And I've done this for people that have issues with Percocet or Norco, and we have kind of complicated situation where either they can't take it, they've had a lot of issues in the past, and we're trying to like add on different things, different cocktails, kind of get them through it. The reason why I don't like to do a lot of big fancy cocktails of like 18 different like things to kind of get you through it is because, listen, you got enough stuff to worry about after surgery. And I very much want to just give you 2 prescriptions, one for pain, one for antibiotics. So you got only a couple things to focus on, because I find that the more you give patients, the more stuff they got to do, the more that goes wrong. Like no one's going to remember to take all the different pills. Like it never happens, So that's kind of how I see it afterwards, my philosophy on that.
Perfect. And I think every physician is different. And it's one of those things that ask during your initial consultation. You can ask your surgeon, what is your protocol for pain after surgery? And that gives you a good idea of, okay, this is what I can expect.
Yeah. And also, everyone's got a different challenge after surgery. So I find that, like, in Sky, you'll know this. Everyone's got that one challenge. For some people, it's migraine. Some people, it's nausea. Some people, it's pain, right? Some people, it's reflux. Everyone's got the one thing that bothers them afterward, and we don't know what that's really going to be. So that's why I have patients, like, they can message me on Instagram. They can call the office. And whatever their one issue is, like day 2, day 3, that we're not able to figure out before surgery because they haven't gone through surgery before, then we kind of tweak it towards that, So people that have had migraines, there's another thing I find. If you had migraines in the past, that tends to kind of show up in the first few days after surgery. Yeah. If you have like reflux in the past, that tends to kind of pop up again. Right, Sky?
Yeah, around day 3, day 4 is when you'll see headaches and migraines. Then I typically ask people, okay, are you a coffee drinker? Because you probably haven't had coffee in a few days, which is contributing to a lot of your headache. Or they'll have reflux. And I'm like, okay, well, what do you normally take for reflux? So a lot of these things that pop up, they've experienced before and they haven't done, or they haven't taken anything for what they typically experience in the last 3 days. So we can kind of target and pinpoint what's the problem and kind of, like Dr. Z said, kind of taper the care around that.
Yeah. And just to bring up, because you brought up the THC and marijuana and stuff.
I was wondering if you were going to give us your input.
Yeah. So very good point. So here's how I see it. So first of all, smoking cigarettes, nicotine, completely against it, right? So like nicotine, vape, hookah, anything with nicotine, we don't want that. I usually say a month before surgery to a month afterwards, all right? Because nicotine makes blood vessels smaller, and it's all about blood vessels and blood flow. And if you're smoking, you're just going to cause wound healing issues and infections and blood clots and all this kind of problems. So nicotine is totally out. Marijuana and edibles. So marijuana and edibles, like Sky said, don't start them if you've never smoked weed or had like edibles before.
Please don't.
You're not going to start. I'm not going to recommend it to anyone who hasn't had it. But I usually in my intake forms, I do ask in there, have you had marijuana pass, or do you smoke marijuana or whatever? And if most people that have it are casual, they're like, oh, a couple times a month, or, socially or whatever. So my philosophy with this is this. Smoking marijuana. So smoking, I want them usually to not smoke for about a week or two before surgery, because it's going to irritate your lungs, and then you can go under anesthesia and you wake up, you're going to be coughing, and it's just going to be a little bit more annoying for you to wake up. Okay. So you don't want to have it before. After surgery, what I tell patients is that if it's day 2, day 3, or day 3, day 4, you're trying to come off the Percocet, but you're not really ready for it, I'm okay with them smoking marijuana, because it doesn't mess with blood flow, as far as I know, as far as I've seen, and as far as my results have shown me. Doesn't mess with any blood flow or wound healing issues. And if they're trying to bridge out of the Percocet to the Tylenol, and they're using marijuana or an edible, I have no problem with that. And it's probably safer in some regard. Remember I said about the doctor responsibly prescribing prescriptions. They found that in Colorado, after they legalized marijuana there, that there was way less narcotic use and abuse. So I'm like, there is a tendency to, marijuana is probably a little bit safer for you than being on Percocet for a prolonged period of time. So if they want to use that to bridge it, I'm okay with that. CBD, I have no problem with that at any point, like the day before surgery, day after surgery, whatever. I don't want people smoking marijuana for about a day or so after surgery, because you're still groggy from the anesthesia, and it's just going to it's going to muddy all the waters in the picture. So that's my philosophy on it.
I love it.
And a tidbit on THC as far as before surgery. THC actually blocks pain receptors. So if you are smoking or doing anything before surgery, it's going to be crazy difficult for your anesthesiologist or your CRNA to control your pain during surgery, because so much THC is on board. So, they're blocking your pain receptors. And when you wake up, you're just going to be it's just going to be very, very difficult to control.
True. Yeah. It's harder for the anesthesiologist too. Yep. So that's like a couple of weeks before is a good time to stop it.
Perfect. One thing that I think this would be a good question for you, Sky, and for you, Dr. Azizi, because both of y'all would be right there at the line when it would appear or when we would notice it, faja burns and lipo burn. I've had, whole episodes about how faja burn is, I really don't think, fajas are causing these huge wounds. But I know from massage therapists that I talk to that they do see faja burn as far as like irritations in the skin, like redness and things like that. So, this is a very loaded subject.
Yeah.
This is very, very definitely loaded. So I can see some type of skin irritation as early as the very next day. And if it's a burn, it's going to typically appear, like you said, like reddened, irritated. It's going to look much different from the rest of your skin. It's going to be localized in a certain area. And then you typically look at the faja to see if that's if the faja is too tight, because that's typically where the faja burn is coming from, that friction. The faja is way too tight. There's nothing protecting your skin. Your skin is dry, brittle. It's raw, just pretty much like paper. It'll rip really easily after lipo. So they are actually burns. They typically are very hard to heal, or it takes a long time to manage these faja burns, lipo burns in general. But yeah, I typically see them as early as the very next day. So I tell people we're checking our skin every day. We need to put ointment on them, or we need to call the surgeon and be like, hey, what do you want to do with this? But yeah, Dr. Azizi, I'm going to let you take the role on this one.
Yeah. So first of all, lipo burns initially. Okay. So a lot of us plastic surgeons were really trying to prevent that and stay mindful of it. So when you're using bigger cannulas, sometimes when you use Vaser, these kinds of things do have the potential to burn. But what I use is we'll use wet towels on the skin right next to where we're lipoing. I use a skin port protector. So as I'm going back and forth in the skin, I'm actually not hitting the skin. I'm just going through this little port in the skin, right? So I can protect the skin and all that. So the area on the body that is have a tendency to do this is along the flanks on your sides, okay? Because the blood flow to your skin kind of comes, think of it this way, it comes from your spine in the middle, and then from your belly, think of it kind of comes from your belly button outward. So what are the areas that are the farthest away from these sources? It's your flank on one side, it's your flank on the other side. They're the farthest from where the blood source is coming from. So the blood flow there isn't as strong. Now, we're trying to create the smallest waist possible. So we're trying to always go heavy, not just everywhere, but of course, heavily in the flank area so we can get your waist in as much as possible. Now, because of that, and what we're doing with surgery, remember, we're trying to take your body to its limit of what it can kind of handle in a safe manner and get you through with the best result. So like, if we're not taking your body to its limit kind of in a safe way, you're not really going to get as much results, right? But you're not going to have like faja burns or anything like that. Now, what do I worry about? If I've taken that skin and that body and all that to its kind of its limit, and then on top of that, we introduce a faja that is very tight, that could set it over the edge, right? So it's not really the faja, and it's not really maybe the technique if you're doing it, but if you're not paying attention to those two things, like, it's day 1 or day 2 after surgery, and they're at the recovery house, or you're at home, and you're seeing that right where this faja is creasing you on that flank. And remember, a really tight faja, it creases you on your flanks, on your sides. It doesn't really press like your back and your belly as much. It digs in on the sides. So you have the skin that's already kind of a little less blood flow. We've hit it harder because we're trying to give you a better look. And then if you're trying to wear a really tight faja, that's kind of like a triple threat to the skin, right? So you don't want to like do hardcore surgery, wear a tight faja right away, and then don't give the skin a chance to breathe. So what I do is like, I put foam on the abdomen and the flanks right on the skin that helps to cushion from the garment so that skin is like much more taken care of and much gentler on it. We tend not to see the burns on the back. So it's not like you really need the foam on the back unless you want to get extra foam for swelling, right? Number 2, the garment I use initially, I don't put you in a tight garment initially because that skin is numb. So you're not even going to feel it if something's burning you or creasing you. And then also, you just need snug support for the first few weeks. You're not trying to you're going to have swelling. You're not going to be able to squeeze every last drop of swelling out with a tight garment the first few weeks. The first few weeks are you just need a snug, medium compression garment. And so the one that I like to use Marina garments these days because they're easier on the skin. So foam on the skin protector ports, these are good. Not going super tight with the garments. And I think that then you can get through it. And then even if you do all these things, it's still surgery. And the only way to prevent complications is by not ever doing surgery. So there's going to be people, 1-2% or whatever, that may get a burn. At that point, talk to your surgeon. Your surgeon should be a plastic surgeon or something like that knows how to handle burns. I've taken care of ridiculous burns in the burn unit. So smaller burns like that, we know what to do. And like Skye said, if you notice it early on, then you're all hands on deck and you can start to treat it with bacitracin, Silvadene if it's really bad, and you just kind of keep an eye on it and get through it. And then hopefully it's only a superficial burn that is at the top layers of skin and that will not scar in the long term.
Beautiful. Yeah. Dr. Azizi, so you've touched on it twice in this episode, and I am trying to find the right way to discuss this in an episode. I feel like I can only say it so many times that we're looking for a board certified plastic surgeon. And I still, when patients are sending me, hey, can you help me pick between these two? Mm-hmm. They still don't understand. And, I feel like it's just another one of those things that's so loaded. And for me, I'm trying to put out blanket statements, right? There's specific surgeons who are cosmetic surgeons who are very talented and are producing amazing results. But for me personally, and I think we can really go into this, I want my plastic surgeon to have done a residency with other plastic surgeons and all they do is plastic surgery and all the complications they see is from plastic surgery and all of their training is in plastic surgery. And, that's what I'm looking for in my plastic surgeon, a board certified plastic surgeon only. So
there's so much there. You want me to talk about it?
Yes.
Okay. There's so much. Listen, there's so much there. And obviously I always preface this by saying I'm biased because I am a double board certified plastic surgeon, which means I did. So the way to become a plastic surgeon is you either do the traditional way was you do 5 years general surgery residency, and then you do 3 years plastic surgery fellowship, which is what I did. So I did 8 years of that. More and more these days, there are what's called integrated plastic surgery residency programs where people just do 5 or 6 years of just going straight into kind of plastic surgery and doing that, right? So this is kind of the way to become a plastic surgeon. Board certification. So when you first come out, the first year or two, you have to collect cases and then you sit in front of a board and they look at your cases and they grill you and they ask you a bunch of questions on all sorts of different other cases you haven't done to make sure that you are a safe plastic surgeon and you're doing like safe work that represents the society and represents plastic surgeons properly. And so it's one of the toughest certifications to get. It's really tough to get into plastic surgery programs. And it's really tough to like go through all the work and effort to become a board certified plastic surgeon, even if you graduated from plastic surgery program. So, okay, so you got someone that is like hardworking, studies a lot, cares about plastic surgery. They've dedicated a long amount of time for it. It's like, okay, so wouldn't you want that for your surgeon rather than someone who did a 3-4 year OB-GYN residency and then took a weekend course in lipo and calls himself a cosmetic surgeon? It's like, okay, well, that's probably gonna be way different between those two people. Number two, like you said before about the complications, when we do plastic surgery, we treat patients with like breast cancer and like burn units and like all sorts of really hardcore injuries. So when you get a small injury from a cosmetic plastic surgery procedure, like a lipo burn, we have a plan A, B, and C on how to like fix that and take care of it. And we've seen stuff that's way, way, way worse. And so we're not usually freaked out by it. We're really pissed off at ourselves that it happened. Trust me, like I lose sleep over this kind of stuff all the time, but we know how to take care of it and kind of get you through it. Right. So that's something that you're going to get from someone who's trained at a very high level. And you're just, you're working with someone who has dedicated themselves to this. They value it rather than someone who maybe went and did another residency and then they saw all the cash grab that was happening. And they're like, oh, I kind of want to get a part of that. Go do a weekend course, go do a 1-year cosmetic surgery training, and then come out and like call themselves a big baller cosmetic surgeon. Now, like you said before, there are cosmetic surgeons who do incredible work. Calvin Jung in Texas, I think, does amazing work.
Amazing.
And if it wasn't for him, I'd be like, I think he brings up cosmetic surgeons. And if all cosmetic surgeons were as good as him, we as plastic surgeons would be screwed because they'd be amazing work being out there, But he has dedicated himself to doing this specific type of work. And also you can see in his motivational posts that he's always trying to be better and better. So you want someone with that personality. So if you take that personality and a high level of training like a plastic surgeon, you probably get the best of both worlds because you have someone who's dedicated to doing good work, who trained for a long time, who can treat you if something goes wrong and they have a plan A, B, and C. And if you take someone who just is very hazy about their background training, they're not like, they kind of talk in circles. If you ask them about what their residency or their training was, then maybe you have someone that doesn't have those backup skills in case something goes wrong or doesn't know when they're doing something wrong. Like an ER doctor who does a lipo course or a GYN doctor who does like a breast implant is not going to know when they're doing something wrong because they haven't like seen where the lungs are and the ribs are and being able to poke through it and like not poke through it and these kinds of things, So things can get hazy quick. I mean, obviously I'm biased.
I'm biased too, you guys.
But I think in general, I know. Listen, in general, you are not seeing as good work from the cosmetic surgeons. And in general, you're seeing some better work from plastic surgeons. But here's the thing. Ultimately, like you got to go to someone who's actually doing that work, putting those results out, got those photos, got those reviews. And that could be Calvin Jung as a cosmetic surgeon. That could be me as a plastic surgeon. But it's like, you're not going to come to me necessarily for a facelift, whether I was a cosmetic surgeon or a plastic surgeon, even though I did a ton of facelifts in my training. Why? Because you want to go to like the best surgeon for that thing. If you want a BBL, you want to get the best BBL. You know what I mean? If you're trying to get a purse, don't you want to get a Chanel purse? Like you just want to get the best that you can,
The best that you can. Absolutely.
Yeah, you deserve the best. Here's the thing. It's your body. It's the most important thing out of everything. If you cheap out on your car, you cheap out on your purse and it breaks down, no big deal. Like you deal with it. If it's your body and it breaks down, man, it's hard to fix that on a round 2 or a round 3. And you have a lot of people that have been burned either physically or, literally whatever in a round 1 or round 2. And it's really hard to fix those problems. So you got to kind of do it right. And you make sure you go to someone who knows what they're doing. And usually that comes along with someone who has done advanced training too, not just someone who took a weekend course.
Absolutely. So the reason why, like for me personally, when I launched this podcast, it was very important to me to bring this, you guys, come on, board certified plastic surgeon, come on. And it was because there was a general surgeon here in the city who was doing bariatric surgery, and he was very popular, doing a lot of bariatric surgery. But as we know, when they do bariatric surgery, they lose a lot of weight and they're left with this excess skin. Mm-hmm. So, of course, the next step would be to send them to a plastic surgeon, right? Mm-hmm. But what's happening is this, the one that made me, I have to bring this to light, is doing the plastic surgery himself. And I've seen some patients with no belly buttons. And I'm just like, what?
Yeah. You see crazy stuff. You just see crazy stuff. You're like, why is this tummy tuck scar like super high? Or
why
something?
is this
like,
at your belly button?
Belly button? Why is there like weirdness here and there? And so everyone going into a tummy tuck wants to have a nice tummy tuck. And everyone goes into like these procedures or breast lifts or something. Well, they want to have a nice one. No one's going in there being like, I don't mind a no belly button or an average job or whatever, you know? So,
I'm only paying, this much amount of money I've saved for 3 years. Go for it. Do your best. And you want to say do your best to a plastic surgeon who has been doing it for a very long time and trained in it. And for me, the most important part is the complication training.
Right.
Mm-hmm.
Right.
More than anything.
Yeah. Yeah. Because it's your life, Yeah. It's your life.
And listen, from plastic, like, these surgeries are hard, man. Like, I do BBL all the time. And every surgery is challenging, whether it's a skinny girl or it's a bigger girl or whatever. Every surgery is tough, even if you do it all the time. Like, I don't lose any sleep over it. But when I'm in there, like, I'm very critically thinking and using my knowledge of all the tons of cases I've done before for that person right there. So every case is challenging. And it's like, if it's challenging for someone who does that kind of surgery all the time, it's going to be super hard or almost impossible for people who don't do that surgery all the time or very often, Absolutely.
And I do want to bring up about Dr. Jung that I do admire. He has his limit. Like, that's why he brought his partner or his, Dr. Chimada came on and he's a board certified, or he's not a board certified plastic surgeon yet, but I know he's on his way to being board certified.
Yeah, I think he's board eligible. I'm not sure, but I think he's a plastic surgeon who's like in that process.
Yeah, he's in the process. And you guys don't be too rough on these guys. It's a process to get board certified. Mm-hmm. So there's a process. And what I do like about Dr. Jung is that he made that stopping point and sends those cases that are a little more complex to somebody like Dr. Chimada.
Yeah. But you just don't see someone like Calvin Jung in the cosmetic surgery community that often. Like, he's the only one I can think of off the top of my head.
Exactly.
I
think that's why I'm like, I can't put out a blanket statement, you guys. I cannot, because he's an exception to the rule. He's not the rule.
Mm-hmm. Mm-hmm.
Yeah.
So, okay, let's talk about this next little subject. What is fluffing and when can they expect it and what can they do for it?
Okay, so fluffing, if you've never heard about it, it's basically like you get a BBL and then after BBL, about 30 to 50% of that fat reabsorbs. So you come out of surgery with a little bit of a bigger butt and then it goes down and then it's kind of stabilizes around 1 month. And then maybe month 2 or month 3, the butt starts to like round out and perhaps get a little bit bigger. And that's what fluffing is. It looks like it's fluffing out, right? So why does that happen? Okay, so ultimately, we don't really know why it happens. I think I have an idea of why it happens. So in the body, whenever you do any surgery, around 3 or 4 weeks after surgery, you get contraction. And this is where things tighten up. And this is like if you had a tummy tuck or you've just had lipo, things start to feel firm. And that's because fibroblasts, which are cells that lay down a lot of the healing kind of lattice network inside of the body, they show up around week 3. And so around week 3, week 4, things start to feel firm. And that's why if you've had like lipo, you will feel like little marbles under the skin, under your incisions, in your like midline by your belly button, on your flanks where we went heavier. You start to feel firmness. All right. And this is fibrosis by definition, but it's not that bad fibrosis that we worry about. Bad fibrosis is like, you've been like, super scarred or super over resected, and it's like something that like lasts for a very long time, years, and it's just not getting any better. This is normal fibrosis. It's the body just going through its healing stages. So around 1 month, and this is why I see patients, because they can feel weird. I see patients around 1 month because they feel weird or things can look funny or this and that. Things contract and they get tighter. So the belly gets tighter. The butt that we worked on, it gets a little bit tighter, and you can feel that firmness in the butt. And so what I think fluffing is that as everything relaxes, including like the lipo areas relax after about a month or 2 afterwards, around month 2 or month 3, I think the butt relaxes. Okay. So I think that is what fluffing is that normal contraction happens around 1 month, and then month 2, month 3, things relax and that skin is allowed to kind of expand outwards. Also, the other thing that happens is sometimes people put on a little bit of weight. So I tell patients that after a BBL, you're going to probably have a new weight that your body is happy at, right? So, and that's around 5 or 10 pounds difference, So meaning that after a BBL, you did all this lipo, we put all this fat in the butt, you got a new butt, new hips, and better midsection. If you gain weight, some people are happy gaining another 5 or 10 pounds because the butt and the hips get bigger and the belly gets a little bigger because you're going to get bigger everywhere, but it's not too bad. And they actually like this new weight of 5 to 10 pounds higher because they got a bigger butt and hips. And yeah, you can still see your abs, perhaps not as much. Cool. Some people like to lose 5 or 10 pounds because perhaps they were a little bigger than they wanted to be. Their belly starts to get smaller. They still got a butt and hips, but they're happier at this 5 or 10 pounds, like lower weight. So I think fluffing is basically that natural release after the contraction that peaks at 1 month. And then the release happens around month 2 and month 3. And then you add in a little bit of people putting some calories in or eating a little bit more and gaining a little bit of weight, and then the butt getting a little bit bigger and rounder.
And that's where we go into feeding the fat.
So feeding the fat, in general, we don't like this idea of feeding the fat in general because people overdo it. All right. So the first thing after surgery, number one, you want to hydrate, right? So you're going to be dehydrated. We give you a lot of IV fluids. We take all this fat off you. You want to drink as much water and Gatorade or Pedialyte or whatever fluid. I don't care what it is. I want you to drink it so that you're peeing a lot. And like what Sky talked about, you want that pee to be lighter colored. You don't want it to be concentrated and darker, right? So then we know that you're well hydrated. When it comes to feeding the fat, the other thing to keep in mind is you don't want to eat a lot of salt right afterwards. The first couple of weeks after surgery, the first month, maybe the first 2 months, don't take in a lot of salt. Salt brings water with it, like equal parts. So if you take in salt, it's going to bring water, and that water is going to sit all puffy in all the areas we worked on, and you're going to have more swelling, and you're going to wonder why. And this is also the reason why people tend to be more swollen on a Monday rather than on a Friday, because over the weekend, you probably ate a little bit more freely, you had a little bit more salt, and perhaps you were a little bit more like mobile. Remember we talked about earlier about the more you move, you're going to get a little bit more swelling, your body's going to bounce back. So over the weekend, maybe you had a couple drinks, you were at a birthday party, you had a little bit more tortilla chips and stuff, and you got more salt, you moved more, and you show up, you're puffy on a Monday morning. But like Monday through Friday, you're usually better about like your diet, you're not as super active, and so you tend to kind of dry up by the time Friday comes around. And then we have this horrible cycle where we all just hate ourselves and turn up fat every week, right? Up and down with our weights. So then feeding the fat, all right? So the first few weeks after surgery, so the idea of feeding the fat is that you want to give it like protein and nutrition and vitamins so that the fat sticks around more, right? So people kind of have this idea of like, well, if I pound my body with calories or food, it's going to help the fat. Now, remember those fat cells you're putting in the butt? In the first 3 weeks or the first few weeks after surgery, they're not taking by calories. They're actually taking because of blood flow. So that's why we don't want to put pressure on the butt, because the pressure kind of makes the blood vessels smaller and there's going to be less blood flow. So whether you have a ton of calories on board or no calories on board, it's not really going to make a difference for those fat cells, because those fat cells just want to get diffusion, osmosis, and just oxygen and blood flow from the area. And it doesn't really have to do with protein or calories. You get like 3-4 weeks out now. And here's the other thing. You don't really, because you're healing overall, you don't want to be in a calorie deficit. So you don't want to be dieting after surgery, because your body is healing. It needs vitamins. It needs protein. It just needs this stuff. But you want to be clean about it. So stuff like avocado, olive oils, salmon, all these good stuff and good fats that we know of, those are better to take in. Like moderation is good. You can definitely have tacos. I love tacos. Have your tacos. You know what I mean? But you can't have tacos every day to feed the fat, because you'll show up super puffy and fatter than you started. And it's not really going to help your butt necessarily. So be clean about it. It's low salt. Have your hydration early on. When you get about 3-4 weeks out, now you're back to what you were like before surgery, which means like you just got to be reasonable about your diet.
Yeah. And maintain that weight. I know y'all heard me talk about those 20 pounds I gained after surgery where it took me a bit to get back off. So it's a slippery slope, you guys. Believe me.
Very much so. Let me talk about the first week of, right? Like literally when people come out of surgery. So I think this is like an area that's not touched on as much. And then you see people kind of overeat because they haven't ate in like the first 3 or 4 days. Like people's appetite is completely thrown off and they have a low appetite. Some guests don't even eat till like day 5. So, and then they tend to overeat for the rest of the few weeks. And it's like, no, kind of take it easy. But just some tips for people in the first 7 days. Of course, Ensures, soups, smoothies are super, super good to like add everything in, like your proteins and stuff to That'll be super easy to sip on throughout your recovery, especially if you're nauseous and you're throwing up. You don't want to then get dehydrated and then you feel super weak and you're not able to walk or recover like you should be on the normal path. But just wanted to touch on like how people can have a super, super low appetite. And to remedy that, I would definitely have your Ensures on deck, have your Boost on deck, smoothies on deck. Even like something like pureed fruits and vegetables are super good. Chia seeds, still fatty foods like your grains and stuff that you can just throw in smoothies and kind of keep it going.
I think it's important also for us to tell you guys, you have to eat. Just because you don't have an appetite, just because you're nauseous, you have to eat. And I can say personally, after my tummy tuck, I felt like it was impossible to eat because my muscle repair was so tight. I had to force myself, and it was usually broths or, something soft that I could just swallow. But very important, because if you don't eat, what happens, Dr. Azizi, to their wounds?
I mean, you need protein. It's like you need blood flow and you need protein and you need vitamins, right? So but just a multivitamin once a day is all the vitamins you need. It's great. Your wounds are not going to get the protein that they need. And so everything's going to kind of slow down. So it's like the next thing after not smoking so that you have optimal blood flow is you want to make sure that you have nourishment. And it's true. You're not going to feel like eating, but snacking is good. Like no one says you got to have 3 square meals a day. Just snack throughout. Smoothies are good, like Sky said. The interesting thing about like fluids and absorption is that like in your esophagus, so when you take in a small little shot glass of like water, let's just say 1 or 2 ounces, you will absorb a lot of that just within your esophagus before it even gets to your stomach. So even if you feel like you're not getting anything down, if you're having little sips of like a shot glass of water every minute or something like that, it's almost like you have an IV drip going because that thing is being absorbed through the mucosa of your esophagus and your stomach and getting into your bloodstream. Even if you don't feel like I can't have a full glass of water or I can't have a full smoothie. It's like, well, if you have little bits of it, it's still going to get absorbed and it's going to help you.
Perfect.
I tend to tell people like with their medications, I'm like, give me 3 big gulps. And then, I kind of bargain and kind of let's do this and then we'll do that type of thing with my patients. And it tends to work well because people, like you said, Mavi, your appetite is just gone, but you need to intake something.
Absolutely. Sky, before we go off today, I want you to tell us, and let me tell our listeners why I'm so happy to have you on the show. So Recovery Homes to us here in Houston is it's something newer. This is something that's just starting, like, the evolution of post-op care. These are popping up now. So I asked my listeners to tell me recommendations and to give me the juice, give me the tea. I want to know, what's going on out there. And somebody found out that it was you who was going to be on the show, and she sent me the longest, sweetest message about you and how you were an angel and that she felt so good and calm and relaxed and just very well taken care of. And, with the podcast, I want us to set the standard high. Let's set the standard up there. So I want our girls to look for people in their area, in their recovery area, that will treat them how you treated my listener. I believe her name was Alba.
Oh, yes. So, yes, it's very important to me. Recovery, I've been doing recovery for a while now, and it's just really, really important to me for people to feel comfortable. Recovery houses, like you mentioned, it's newer in Houston and kind of newer in Chicago. But if you tell your friends or your family, I'm going to a recovery house, it sounds kind of weird. You're going to this stranger's house. You don't know that person. You don't know what could happen. You don't know how they're going to take care of you. So it's really, really important for me. And I would hope for the listeners to find someone that is knowledgeable in the care and that really, really cares for people the way that a family would care for their family member. So yeah, I just try my best to make people feel comfortable, safe at home. I mean, almost like we're friends forever, kind of. When I talk to people before the moment they see me, they're like, oh my God, I just feel like I've known you forever. And that just really, really makes me feel good. So I'm glad that resonated. I'm glad she wrote to you to to express her feelings. That makes me feel so good. I'm a crybaby, so I'm not going to cry. I'm not going to record my tears up here, but that makes me feel really, really good because it's really, really hard to take care of people in their most vulnerable state. And just like your surgeon-patient relationship, it's a two-way street. So many people want to feel comfortable in their recovery house. And it goes for me too. I want to feel comfortable with the people that I recover. So it just makes me feel really, really good to hear that, and that all my hard work and my tears and my blood and my sweat has just resonated to people. So I'm glad that you told me that.
All right, I'm going to get in here and hype up Sky a little bit too here, if she needs any more. So, like, I worked with Sky here in Chicago at a surgery center for a few years, and she took care of like 1 million of my post-op BBLs and tummy tucks and like patients and stuff, right? And it was a year ago, and we were talking about like there's no recovery houses, and like we need to do something or something like that. And Sky had thought about doing this, and it was like a very natural transition. Why? She cares about patients. She's a nurse, so she knows the clinical stuff that's important and not important. And she's seen a lot of these post-op patients. So it was a very like natural transition for her to set up this recovery house. And I hear so much positive stuff, and it's amazing. People that know that we're associated and don't know we're associated, I just get like a ton of positive. Everyone loves Sky and her recovery house. And it's like, I don't hear anything negative. You do see a lot of other recovery houses online. If you start following a lot of recovery houses, you will see some sketchy stuff. You will see like owners like out on the street yelling at like patients. And it's like, God, this is ridiculous. And it's like, or you'll see places that do not look clean. And it's like, you would never want, I could never recommend a recovery house that I couldn't send a family member to, because these people come to me, they pay big money. They're in a very emotional state. As much as I want to care for these people, I need someone else who's going to care for them too. And you saw like this popped up, a few moments ago when we were talking about the pills, and Sky is like, she's like, just, remember she said about, she's like, just give me 3 gulps. Like, someone who doesn't care would be like, all right, you don't want to take your pills, cool. But she's like actually like bargaining and trying to figure out how can we get this person through this. And that's like, if you don't care about the patient and you're in this role and you don't care and you're just doing it because, you took a weekend course because it's going to make you some money or something, it's just all going to fall apart. And you want to go somewhere where you're taken care of and this kind of thing. So I haven't talked about this too much, but I do have a new facility and an operating room and a whole thing that I'm building out, which we're going to be at in the next few months. It's going to be all fancy schmancy and like awesome. And
I can't wait.
And then I can provide stuff like the hyperbaric chamber, like these things that I want to do that are like, I can't do unless I have it here. The second floor of this place is actually going to be a recovery house. And the plan is to have Sky have her other location of her recovery house upstairs from my facility. So it's going to be like this one-stop shop and like all easy for patients so that. And I would not want to work with anyone. Listen, I would not want to work with anybody who does not care for patients at the super high level that I want to. You know what I mean? Like anything less than excellence, I would not want to work with that person. So it's for me, it's an honor and a privilege that Sky would want to be at my facility. But I think we both align on like that Chanel approach that we talked about, like treating patients like Chanel and Rolls Royce. That like it's not a volume thing, it's a quality thing, and
Absolutely.
Like everyone needs to be treated like family and give them the best technology and for me it's technology, education, safety, care, understanding, all that kind of stuff. And for Sky it's like care and understanding and like being there when they're like in a very vulnerable thing. And then we uplift all of plastic surgery and all this kind of thing, because then if hopefully, yes, I'm biased, but if people are doing it like this, like how Sky is doing it and how I like to try to do it, then everyone has a more pleasant experience and we don't have as much negativity out there in this field that is such a crazy field that brings both high highs and low lows to many people's lives.
I think you worded that perfectly, because
absolutely perfectly.
Because that's what I've been trying to do since I launched this podcast. Let's set the bar high, and our expectations as patients should be high from what we want our surgeons, our board certified plastic surgeons, and our recovery houses. Like we want nurses, we want, educated and skilled professionals to take care of us during our recovery. And you hit the nail on the head, because the more unprepared and the more that our listeners take lower quality and lower standards, the higher this, like, I don't even know what to call it, kind of this bad view on the whole process.
Yeah. It cheapens the whole thing. It cheapens it, not like financially. It takes something that could be such a great game changer for someone's life, and it cheapens it into something that is a big negative thing that they never kind of bounce back from, and it's your body. People deserve the best. It's like, if you're going to do it, just do it right.
Do it right the first time.
We're not selling coffee. It's like, this is, it's not just like Starbucks. Oh, they burned my coffee a little bit. No big deal. Like, this is your body. You got to do it right. And if it's your body and it's you deserve the best for you, So that's, I think we all align on that.
And you deserve like a team, like a closed loop team that, if ever I have like an Azizi patient and I'm concerned about something, like I'm shooting him a text like, hey,
look at this.
Yeah. And then, we're, like he said, we're so aligned on safety and the well-being of our patients and the happiness of our patients that just takes it. The closed loop just makes it such a great experience. And that's a lot of what recovery is, really, right? The experience of going through things and kind of having someone to bounce ideas off with, and just having someone to guide you to you have so many questions that people are asking you. Could you imagine if someone had like a great person to just answer everything confidently and send them on? So I'm just trying to change the recovery house. Change the game and change the stigma around recovery houses, and like Azizi said, just be the best that we can be. I'm so excited for our collab, but level up.
Level up. That's right. That's kind of what the whole theme of the podcast is like. Let's level up. This is an experience. I had somebody I was talking to yesterday, and she was like, "Oh my God, I got my quote. It's as much as a car." And I was like, "Look, you get out of the car."
Yeah.
That's the end of the sentence. You get out of your car. You can leave it and trade it for something else. You cannot get out of your body. You cannot trade it for something else. So you can't go cheap. You can't. You can't. I don't know what other way to say it. You just can't. You have.
And then if you go cheap, you may be unhappy, and then we're back at square one.
And that's going to cost you more in the long run.
And you're going to cost you more.
Because revisions, surgery, it's a lot more expensive. And you might not even end up with the result that you wanted.
Mm-hmm.
So we want happy patients, happy, good results, an overall amazing experience, something that you can tell your friends about and just be like, oh my God, it was amazing. I thought I was prepared for something more, and it actually wasn't that bad. So I'm super happy to have both of you on. And I think we are all on the same page as what we want our listeners to expect.
Awesome.
Absolutely.
Thanks, Mavi.
Wait, before we go, last question.
Oh, I'm here.
Last question, because this was on twice. When can they get in the pool or into the beach?
Yeah, I always say, okay, so pools and soaking, I usually say about a month. That's when your incision is pretty strong. Remember, your incision is going to be pretty waterproof, around week 2, week 3, but it may not be ready for soaking. And if you wet that incision too much, get too much moisture on it, it's just going to kind of get like soggy bread. It's just going to kind of fluff apart. So not good. So if it's a month later, that's kind of the minimum, and that's if all your healing goes really good. Now, the other thing people ask about is a wedding, right? So when can they get work done before a wedding? Remember, first of all, everything in life always goes wrong when you're trying to plan it, right? So if you're going to have a wedding, you're going to be the one person who has a complication or something, because that's just life wants to throw you a curveball, right? So I always feel really paranoid if someone's having a wedding maybe less than 2 months after a procedure. I'm like, you got to give yourself at least 3 months after a procedure. I don't want people dancing at the wedding worried about pain or something like that.
Yeah, absolutely.
So minimum, you give yourself 3 months between your wedding and having, pretty much most of these procedures. If you can do more, 6 months at least, I think that's even better.
Even a breast augmentation, you guys, because those implants take a little bit to drop and be in place where you want them to be for your wedding dress. So
6 months is safe. Don't rush it.
Don't rush it.
It's an important thing. Yeah. Don't get the plastic surgery or whatever. I never want anyone delaying a wedding. I've heard this before. They're like, I can delay my wedding, if I can get it on your schedule. And I'm like, dude, please do not delay the wedding for me at all. Your poor husband is going to be like, dude, who is this Dr. Azizi a-hole who makes me delay this whole thing, So just plan it out and give yourself at least 6 months of recovery. That's the best.
I think I agree with that statement. 6 months before any really important event where you want to be at 100%.
Mm-hmm.
Yeah.
All right, you guys, thank you so much for coming on. I am so excited to get this episode out because I feel like it's going to answer a lot of the questions that kind of have been floating around there. And it's such a joy having y'all on. It's a pleasure.
Yay! Thank you so much. I appreciate it.
And Sky,
thank you. It was a pleasure. I love talking about this stuff.
Dr. Azizi, we know where we can find you, but Sky, you haven't told us how to find you.
Yes. So on Instagram, Facebook, Twitter, TikTok, all Shapes Recovery House. Our website is shapesrecoveryhouse.com and all social media handles is at Shapes Recovery House.
Awesome. And Dr. Azizi, we know at Dr. Azizi Chicago. That's how we can find them. So you guys, I hope y'all found the amount of knowledge that was dropped in here. Amazing. And we'll see y'all next week.
Bye.
I would like to end this episode with a huge thank you to all of our listeners. If you enjoyed this podcast, make sure to subscribe to Big Butts No Lies Podcast and follow us on Instagram at Big Butts No Lies Podcast. If you have a topic you want me to cover, please send it to the DMs. If you know anyone on their plastic surgery journey, be sure to recommend them the show. You can also visit us on our website, bigbuttsnolies.com. You'll see the online surgical recovery store. We're adding new items all the time. If there's something you think I need to have on there, send me a DM. Don't forget to leave us a 5-star rating on Apple Podcasts. And don't forget, new episodes every Monday. I'll see you then.